Welcome to IEP Radio, a show dedicated to the education of all things indoor environmental quality related. And now here's your host, Michael Schrantz.
Hello, everybody, and welcome to IEP Radio. This is episode 6. Today, we're going to be talking about the International Society for Environmentally Acquired Illness, or ISEAI, and getting a better understanding of how ISEAI helps us connect the dots between the health of the patient and the health of our homes. And to help get that job done, I've invited our special guest, Dr. Mary Ackerley, who will be with us here shortly. Wanted to tell you a little bit about Mary. She is a classically trained board-certified psychiatrist. She is a summa cum laude graduate of Harvard University. She has studied at the National Institute of Mental Health and finished her residency at Johns Hopkins and was certified in psychiatry and neurology. She holds active medical licenses in Arizona and Florida. And really important to today's podcast, she is one of the co-founders of ISEAI, which is incredible because beyond the fact that I am also a board member, she really was there from the ground up. And she's been an amazing friend, a colleague, mentor in my life, in my practice, and really has just changed my view on even how to approach assessments, patients, how to work with them, talk with them, and get an idea of chronic illness because it's complicated, right? It's not just simply pointing at some sort of an exposure that you can see, say, remediate that, and everyone's life gets better. And Mary is the perfect person for the other side of this, the medical side. She's an integrative holistic physician. She specializes in natural treatments. She commonly sees patients who suffer from anxiety, depression, brain fog, chronic fatigue. Her skills include the ability to manage cognitive and psychiatric symptoms often found in complex chronic illness, protocols for biotoxin illness, which may involve conventional and integrative medical treatment. I mean, the list goes on and on for her, and I'm truly honored to have the opportunity to speak with her today. Welcome to the show, Mary.
Hey, Mike, it's really nice you invited me to be on it.
You're welcome. This is going to be an absolute joy and pleasure today. I get this question right off the bat, what's ISEAI? And I know that I'm a board member, but you've really been there since its inception, so I figured we'd pose that question to you to see if you could do a good job describing what ISEAI is and what its purpose and mission.
Absolutely. I've been involved absolutely since the beginning, which I think was February 2017, along with Sonia Rappaport and Keith Bernstein. There were several other people along the way, but there are challenges. You're founding something new. It hasn't existed before. And as our vision clarified, other people found that it wasn't really quite their vision. So we went on. It was the three of us meeting every week, hammering out who are we? What is even our name? Our name is International Society for Environmentally Acquired Illness. And international is meaningful. We have members in Canada, England, and Australia, as well as the US. And as you know, we're growing very rapidly. I expect more countries to be involved since this is a global issue. It's society. It's actually a professional society. We have founded that until we educate professionals to recognize and treat environmentally acquired illness, we really don't serve patients. So one of our major focuses really is educating healthcare providers, and that's more than doctors. Doctors are really important. It certainly is DOs, of course, naturopaths, but some of the ancillary services too would be chiropractic and optometrists. So nurse practitioners, very much a part, is everybody who's seeing patients. We want them to have a blueprint for recognizing what we're talking about and having tools to treat it. So it's a professional society and it's nonprofit. We're not making money from what we sell or do. And it means, I think, that the advice we give may be more factual and true. It's not biased towards making a financial profit. Environmentally acquired, what does that mean? Well, at first it was mold. It was going to be about mold because there's really no professional society for mold. And that's certainly, Mike, how far do you and I go back in Tucson? 2011, 2012, long
That feels
time.
about right. Yeah, that feels
Right.
right.
It's, going on 9 years or so. So we've worked together a long time, and it's been about mold. And you're called an IEP, but I know you mostly more as the mold man. It's, you're investigating it, and you're my eyes for what I can't see, and you're helping people actually remediate or diagnose what's wrong with their homes. But as time's gone on, it's realized patients are more complicated. Mold is what I call the great catalyst. It sets off just an enormous amount of toxins, little buckets and piles of toxins all over the body, all over the home, that people have been dealing with until mold comes, completely dysregulates the immune system and the hormone system. And with that combination, besides taking out the brain too, which is what I'm most interested in sometimes, it leaves just a fertile playground for everything else to start showing itself. So Lyme is a big part of this. Ticks are in our environment. We can't really stop them. They've been spreading rapidly. It's 300,000 a year that's admitted. Most of us feel there's much more, and it's been going on much longer than any of us know. And in fact, Arizona is a Lyme state. And we do have Lyme patients who, as far as we can tell, got it here in Tucson. So lots of growth and growing to just include, okay, now it's not just mold, but a lot of these patients have Lyme. And then there's Bartonella, and that's cats, or it's ticks, or it's both. But most people have been scratched by a cat at some point. So these are infections that really influence what's going on. There are gut infections because the gut is so dysregulated in mold. And viruses. But then we open up the real Pandora's box of all the other environmental toxins that people are exposed to every day. The pesticides, organophosphates, androgen or estrogen stimulators that are in some of these pesticides, and also the chemicals commonly used, not just to clean, but to keep our sofas from bursting out in flames. All of these are part of an indoor environment. And so, so now we have toxins, but then there's heavy metals. So you get it. It's an ever-expanding list. Glyphosates are probably my personal favorite right now, of like, oh my goodness, how long has this been going on? That Roundup, again, part of the environment, has become a carcinogen. And at this point, 3 people have each won $80 million for having non-Hodgkin's lymphoma. So it's like, well, I thought Roundup was safe. So you get the idea. It's not just an epidemic, it's an epidemic that keeps growing as more scientists and laymen discover that things they thought okay, like lying on their couch, is actually dangerous in a whole lot of ways. And so we have environmentally acquired, and then there's illness. So it's inflammation is major, but there's illness. And with that, we're hoping with an acronym that people can at least remember, ISEAI, we have a society, but a whole lot has gone into even thinking about that name, getting it registered as a profit, and then developing the vision of what is it we want to do. And I think a big thing, because you've certainly been involved in these discussions, is we want a nonprofit society that's non-biased for professionals that interacts in respectful manners, that includes inclusive views, because something I like to point out on our email list often is there's nobody here who holds, the answer for any of this. There are no double-blind controlled studies at all in anything we're talking about that shows that there's only one way to treat this, diagnose it, nor is there any patient really who has only one thing. So what I'm trying to say is that we are really here to teach clinicians, but also then to educate the public, and educate the public on an individual level, which is something you do, Mike, every time you walk into a home and point out, did you ever notice, like, it looked a little moist there, or that, that there's some rain that came in during the monsoons, what happened, et cetera. It's education on that level. It's education on the fact that, really you can't get away anymore with eating non-organic because of the many things. So there's education to the public to wake up that their indoor air environments are extremely unsafe in many ways, that we all think we have the basics, clean air, clean water, and clean food, yet we can name a number of toxins for each one of those elements that are creating really poor health. So,
right. What we say is green is not as green as we thought it was, or as clean as we thought it was.
no, exactly right. It's like, but I thought that, building, that green building material was supposed to, prevent mold. And that's the Chinese drywall, the green stuff that turns out to have contained mold, drawing moisture, and is destroying buildings from the inside out. That's one small example. So there's the vision then of that kind of education in a nonprofit way of letting people be more and more aware that they can't be careless about a lot of this stuff if they want good health. And then there's a research component that we really have a vision to, is when I say we don't have the answers, what's best is we really want those answers. And in fact, we already have a partnership with the University of Arizona School of Public Health. We have the professor teaching a course there on environmentally acquired illness, and she's a member of ICI. And in fact, we've already started doing some research on the stuff. I'm most interested in neuroquants and hope to expand into other areas. So research is very big, but the vision of all of this is to educate and train and make aware a very large amount of people of how toxic the world is, what they can do to heal it in themselves, prevent it from happening again, and possibly even make a difference in changing the way we live so that the world does have clean air, clean water, and clean food.
And I think that's the segue, Mary, because the old model, speaking for the IEPs out there, and certainly we've been called worse, but is that we came from an industry that was maybe predominantly industrial to begin with. We switched the conversation from mold to chemicals, where we look at things that OSHA does to protect health, but when you look at the guidelines and how much of a contaminant, a concentration you can have, it was measured in exposures in terms of hours, like an 8-hour exposure, a permissible exposure limit, or a 15-minute short-term exposure. And that's hardly the chronic exposure concerns that we're talking about, but that's where, in my experience, a lot of the old dogs of IEPs and even some of today lacking that understanding that you don't need to have 20 square feet of visible mold growth or a 50-gallon drum of benzene with the lid off in your living room to constitute an exposure, and that anything less than that is just your imagination. The struggle, I think, for all of us, certainly the IEPs, because we're not qualified to diagnose from a health perspective. We try to find sources in homes using the tools and talents that we can bring, is that you said it earlier, no one has I'll use it, a cheat sheet. No one has a secret formula that says, well, based off of the age of your home and your blood type, you're allowed to be exposed to use a generic example, 14 spores of mold X. But if it was 15 spores, your arm's going to fall off. Right. And it's invited a couple things, a realization that there's a lot more going on than we knew. Your chemical and Roundup points you made earlier are fine examples of that. And also beg that need for education and collaboration, because people are making very costly decisions with their health and their home to avoid exposure.
Right. Absolutely. I think just going back to even the first point is we're always dealing with the argument, the dose is the poison. It just doesn't apply anymore. The amount of poisons we're exposed to in small amounts, but multiple amounts of these poisons is a very different model than you have your 50 gallons of benzene and you've just, inhaled it for 2 hours. Now you're sick. And so there's also the idea that the body excretes this stuff, and that's pretty mistaken in a lot of places too. It's not just you're exposed that you can get rid of it, is some of this stuff can be hanging around like lead from childhood. It didn't go anywhere. So things just keep getting added on. So It's the complexity, it's the inflammation, it's the chronic complex illness that we see in so many different ways now, from children with allergies, asthma, and autism. I think the last statistic I read is 1 in 35 kids have autism. It's so common that we just use the word quirky, and there are different varieties of quirky. Right. But it's really not that cute, and it's an enormous burden on parents and on society to educate, train, and to essentially, what one parent said, it's like I'm reverse engineering my child back to what he should have had when he was born.
Yeah.
And I believe most of it is environmental. There's a Harvard professor who now says women shouldn't breastfeed. The common toxic levels of a childbearing woman are so high now that they're a toxic danger to
scary.
Children. That's really scary, and I can't believe it doesn't get more play. That's how bad it is, and how bad autism is. So it's most of the people I see can't ignore it. We want to educate those people who still have the luxury of pretending this isn't happening. And right. Certainly my work with you brings that in. Actually, there's one thing I do want to just bring up is you got to check out a story came out in the New York, I think the last few days. Actually, my chiropractor secretary just told me, I read in the New Yorker and thought right about you. And it's like, what? Is it one of the crazy psych cartoons there? No, it's a story on how toxic Thanksgiving is. Really good. Have you seen it yet?
No, but it's like, okay, now we're attacking Thanksgiving. I'm afraid to know what
No, we're not attacking Thanksgiving. We're simply documenting a bunch of grad students in Texas who just, using just particle meters, of particulates, CO2, benzene, VOCs, document the indoor air as they did the typical things with baking, using toasters, ovens, gas stoves, keeping the windows closed, how toxic it came to the level where it was would be considered a danger if it were outdoor.
Even from, yeah, right. Even, I was going to say, even through the eyes of the EPA, which helps control outdoor, and even through like more of an industrial feel for short term. And gee, are we really that surprised that many people working in a closed door box, building up these contaminants, which we loosely say are things that your body doesn't like, get to a level of concentration? It's just a paradigm shift. It's an appreciation. Whereas back, decades ago, we just passed off whatever symptoms you were having as just having a bad day at work. Take a couple Tylenol or aspirin, and now from your side of the fence, you see, I don't know where the numbers at, hundreds, thousands of people who are affected by, maybe not at Thanksgiving every day, that type of an exposure, but it doesn't have to be just about the foods that we're using or the devices that we're using in our home that create carbon monoxide or other factors. When you combine it together, it's a soup of contaminants that you're being exposed to. And if you're susceptible, if that's the right way of saying that, the penalty is a lot greater than somebody who can otherwise be in that type of environment.
Right. Also, a long time ago, we used to open the windows a lot more. Yeah. And not worry so much about the cost of energy. Opening the windows would have done a lot. It was closing the windows and keeping it energy efficient while then generating all this particulate and VOC that led to the toxicity. So I just think you might find it an interesting article exactly about the soup. And they weren't even measuring mold or anything exotic.
You bring up, I'm glad you brought up not just that story, but a reminder that what you've done now twice about the fact that we're not just looking at mold, because you're absolutely right. On one hand, you can argue that mold is a great surrogate for other biocontaminants where perhaps moisture is the catalyst, water damage, water leaks. You could argue that you can test for other things like bacteria, but you get into great discussions, but good debates about the value of that test, and a lot of people are stuck. So it's about figuring out, though, that while we were testing for mold, there's other things. There's off-gassing of materials, whether it's the formaldehyde from the new cabinets, whether it's occupant lifestyle, the example you used in the article that was out a few days ago, and coming to appreciate that. On one end, I feel like there's that struggle. So for those that are listening, It's this idea of, on one hand, it's getting away from the acute, the obvious problem that you can see in order to justify an exposure. On the far other end, we deal with the struggles of extremeness and dealing with the reaction that we hear from society or from even patients, and trying to find that balance of how far do we go with a great example is, a lot of times when people are sick and they do some of their own sampling, they don't know how to interpret it, or maybe it's really not that bad, but they go on some social media group, they kind of hear the fear factor approach and they panic. And so there's a concern on the other end of the spectrum, which is that there's a big fear factor approach here, and that's causing a lot of uprivaling of people. They don't know what to do. Everyone has to sell their home. Everyone needs to burn all their clothes. And I don't know that that's the solution either. The struggle for me now is trying to figure out, how do we achieve that balance? How do we meet in the middle? I don't think that everyone needs to necessarily be living in a high desert in a tent as a solution.
No, because it's not a great solution. I mean, tents still have off-gassing.
Right. Go figures. Yeah.
And there are a lot of allergens and pollens in the air too. And
True.
we all need, on another level, we need a sense of safety, which most of us don't have in a tent anymore. And we all need a sense of community. And again, that's hard. So I believe family and community are important. So isolating oneself in tents and going from hotel to hotel room causes damage too. I like to point that out, as well as just avoiding endless minute amounts of spores. So I think you and I have talked about this, is that, yes, there is a wide spectrum. On one hand, we're trying to wake up people like, hello, maybe after Thanksgiving, you're not falling asleep just because you ate too much turkey, but because the gas carbon monoxide was too high too. Trying to wake up a lot of people of, do it so you don't fall into the group that you and I see, which is increasing and increasing, of people who are so sick that their brains don't work very well, their bodies don't work. They're clearly sick by anyone's measure, even if we don't have the tools or diagnostic codes to always cleanly say, this is what you have.
There it is, right there. It's tip of the spear. It's being transparent and realizing that this isn't. This is it, folks. This is a group of professionals that I have seen, and it's not just clinicians. We have a wonderful group of environmental professionals, folks like myself, working together, trying to work together on the clinical side. What can we do in the field to help answer questions for the clinician and the client, that sort of thing. And I'm glad that you're talking about diet, because even talking with other folks like Chris Kresser and others, we know that your diet could be a big part of your total effect on your body and your health. And what I love about ICEAI's group and organization is that they don't appear to have tunnel vision, and quite literally it's the opposite. It's going, I think we're spending too much time chasing a spore. Not that there's times where a mold exposure, and arguably probably in a lot of water damaged building, there's something to be said about that. I can certainly speak from experience, but to not be so close-minded that there might be something else going on, and that it's not just the M word that we're worried about. It truly is a holistic approach from the inside of your body out.
Yeah. M is Mrs. O'Leary's cow. It's the mold word, the M word. It knocks over the bucket of all the other accumulated toxins. I've never seen a person get well. I shouldn't say never. Probably 95% of people I get well or work with have to do multiple things to get well, besides just get out of mold and pull it out of them.
Right.
They have to fix their gut, they have to fix their brain, they have to get their immune system, they have to put infections back into being more closely regulated by their immune system, and many other things. And I think one thing that Mike and I talk about a lot is, because you're great at diagnosing mold, and you're also pretty good at saying this house looks okay. And there are people who find it very hard to ever be reassured that a home could be okay for them. And that's the place where Mike and I will talk, is the work that I do, which I work a lot with the brain. I'm a psychiatrist. As we know, we all have a limbic system, but as on neuroquants, which is a volumetric measurement of gray and white matter in the brain. We look at about 50 regions in the brain, and you can see a lot of things. I can see who's had TBIs that never knew it, another environmental acquired. You and I grew up, well, I'm older than you. When I grew up, if you were breathing, when you got up, nothing happened. It was over, right? Wasn't a TBI, it was like you got up, that's life, kid, keep going. And you can see on the neuroquant damage really from 50 years ago, when people have had multiple TBIs in football, sports, we know now they do enormous damage to their brain.
Right.
So you have that compounded with the fact that you're inhaling mold and you're healing other contaminants. And I think Keith Bernstein has just done a great job of showing, the 30 things that are in a water damaged building. So when we talk about mold, I've always said it's just the cheapest and easiest to measure. We can't measure the fungal spores and the VOCs so easily, and the bacteria, et cetera. Although you started to measure some of the bacteria, I think, Mike.
Certainly, but it's
some
not,
research on
it's
that.
an art beyond the science, and it's you have to know how far you're able to really say something with confidence. And at the end of the day, I don't just couple any decision off of a bacteria sample. I'm combining it to what we know about their health, and that's where the clinician comes into play, which is why this is such a powerful relationship.
Right. I always tell people I really trust your findings, what you say, and I've learned to read between the lines too. I think you can tell people things and they may want to hear one thing, and it can be very hard to reassure them it's okay, or you may tell them it's not okay and they don't want to hear it. You can tell them 9 times and they'll still tell me, but he said it's okay.
Yeah,
and I'll read the report and said, really doesn't look okay. You sure he said it? Well, he said we might have to do more testing or something. And I'm looking, that's a lot of stacky there.
Yeah.
So that's the kind of, I've learned over the years to read what you've said, know you, and then know what the patient's interpretation is in between, because both of us have the goal of getting them healthy, and we have to work together, because you can't do this on their own as a clinician, and you can't do it as an IEP. That's probably our message through all of this.
Yeah.
But going back to just, you can see in the brain a lot of things. You see TBIs, you can see Alzheimer's, unfortunately, and many patients have major cognitive issues, major psychiatric issues that are coming from inhalation of the soup through their nose. And hey, guess what's right next to the nose, guys? The brain. And it's a fairly thin barrier. We know bacteria and viruses can easily get through. We know bacteria at least, and fungi grow in the brain, and VOCs can easily get through. And we see a lot of brain symptoms, but we also see on neuroquant a lot of brain abnormalities. So one of the things I see clearly in a group of patients who are not, it's not diagnostic of mold, it's diagnostic of patients whose limbic system is on fire. I mean, we can just call it, these are the real fire patients, where the components of their limbic system, the thalamus, which is your pain center, so that's an amplifier, sound, so you really have a preamp and an amplifier that are picking up the tiniest sound now and amplifying it into a much bigger sound than it is to other people. Thalamuses are very overactivated. The amygdala, the infamous amygdala, the fear center, the fire alarm. I have a lot of people, 99%, their amygdala is bigger than 99% of men or women their age. And I see a lot of them. These are the people with the thalamus amplifying the signal, with the amygdala, a fire alarm set to go off for, just a tiny whiff of smoke that might go through, with a hippocampus that's also up there in the 98th, 99th percentile. Hippocampus is memory and emotional memories. So they start getting triggered with emotional memories of other bad things that have happened in their life. And that, together with a roadway in the brain that corrects the front of the brain to the back of the brain, the anterior cingulate, all are overactivated, just kind of looping these fearful messages, which again set off fire now through the immune system and through our nervous system, the sympathetic nervous system. So you start seeing tachycardia, you start seeing raised adrenaline, and that keeps it going. So,
and to use the analogy, when we have environmental exposures, is that akin to throwing roadblocks in the way of these connections in the mind?
I believe the environmental exposures are what's leading to the overactivation. They're setting off probably mast cells, and which is the first responders in the immune system that are in the brain, that are in the blood-brain barrier surrounding the brain. They are contributing to edema or to the retention of some of these toxins. So different reasons, but there's overactivation.
Right.
So at that point, the person is feeling on tilt. I think that's a good word. They're on tilt. Bad things happening, so bad things.
Additional thing.
Right. This is another thing, and I don't want anything more bad to ever happen to me again. So you can't really reassure them. And this is where I come in, where I will work with different things, particularly with mast cells and supplements and remedies, and also suggesting mind training that helps kind of restore a balance between our emotional parts, our limbic systems, and the prefrontal part of our brain, which is our most evolutionary advanced part of the brain, which helps us plan, organize, and make decisions, are some of the major things it does. And restoring that balance tends to bring about a more reasoned discussion, whether it's in the realm of, what is toxic, what is poison, where people arguing kind of wild positions and having difficult time seeing gray. No, we can never perfectly assure your safety, but we can say there's a really good chance it looks like that this home is really pretty good.
And that's what they need to hear, because that's the truth. And I just think with Icy's type of background and knowledge and years of experience and the passion that it seems that everybody has on the clinical side can say, I mean, this is tip of the spear. It's not like there is, again, some cheat sheet to go to for all of us. So it's such a wonderful opportunity for those of you that are listening, whether you're on the clinical side or you're a patient or you've always wondered what was wrong with your husband or whatever the issue was, to go on IC's website and learn more. And I want to talk a little bit about, before we forget, and I know we won't, but there is so much information, but there's this upcoming conference. And Mary, I was hoping you could maybe talk a little bit about that, because if there ever was an opportunity for somebody who was really serious, especially on the clinical side, who wants to attend, I would argue this being the inaugural one, this is the one to go to, but it is right around the corner.
Right around the corner, and it's literally right around the corner from us too, in Phoenix, and a little north of Phoenix, in a newly renovated resort that is basically setting out to be a budget canyon ranch. So it is really a spa-like setting in the desert. And it's meant to be relaxed, and it's meant to foster an inclusive spirit of people who are pioneers together, trying to look at a world that keeps seeming more and more toxic, and to learn to work with patients in ways that probably, I don't use the words right or wrong. It's like, what's the most efficient way here to get this patient better? What skills do I have to get them better, say, in a year and not 10 years? In fact, one of the people involved in a lot of our work with bringing ICI into fruition, again, which takes a lot of backstage players, doing different things, recounted the story of her children with some major psychiatric symptoms, where it took 11 years from like 5th grade to college to get them healthy and well. And of which, it wasn't really like till year 4 or so they heard about infections and PANS, and then infections and Lyme. It was only about 2 years ago someone finally mentioned the word mold. And it was, again, the combination of everything that's gotten them well now. My contention, and I would say anyone who's treated patients like this for a while would say, if the mold had been discovered right away, we probably could have cut 11 years down to at least 3 or 4 here.
Right.
So I think that's our goal, is to find efficient ways in sequencing treatments. And for clinicians who are interested, is if you're seeing patients like I'm describing, like Mike's describing, that they're sick, they're being poisoned in some way, and you're seeing increasing amounts of people coming in who think they have mold, who know they have Lyme, and your recipes aren't working, this is the place to talk with other people. in a respectful way where we acknowledge we're all finding our way here, but also learn, hey, here's some people who've done this for a long time, what's worked for them, and where is the research? What are the research questions we can be asking, and how can we get people in academics interested in working on this and doing the kind of research that other academics respect, and then go to government agencies where they respect this research. Because that's a really important part of this, is bringing everybody on board to work together to get the message out. These patients are real and their issues are real, and we need the research and we need the clinicians, and we need the population. And at some point, hopefully, some sort of political clout, to be honest, that would give us a clout to bring real information to people who can make change on much bigger levels and platforms in government. So I'd say that ICI is looking at this as being a major leader in promoting the kind of education and work, and that includes the IEPs. You know that as, okay, we know what the EPA says now. We know it's very outmoded for what's really going on. And how do we get that kind of research that takes into the complexity with the patients we're seeing to support? Hey, it would be lovely if you could walk around with the magic wand in each room and just get a reading where it went, blue, great, yellow, could do a little work, and then green, and then red, oh, let's run out into the next room. That kind of little magic wand where we all agreed scientifically we knew what we were doing. That would be a dream a long time from now, but I think you know what I'm talking about, is having
that sort of certainty. I don't see in the foreseeable future, which is why I also appreciated you saying that you really do have, this has been such a warm, really a sense of family with the IC members, because there's an embracement. Everyone knows they're in certain areas, it's charted territory. In other ways, it's uncharted territories. And for those of you who are like, I'm going to go to the source, you're going to find yourself right back here. This is the source. These are the brightest minds, some of the brightest minds, and they're always looking for more to get that united voice so that there is more clout, there is a little bit more political representation. It's no different than an IEP saying, we wish that this had enough influence to affect your local building codes so that we can build our homes smarter, from the building materials, which you can compare to as human diet, to to mechanical ventilation and exposure, that sort of thing. We need that, but this is going to come to a shock to a lot of people, that sometimes people are led by greed and money, and that sometimes your health is left, in the dust. And so it's going to take a powerful movement. It's going to take constant rehashing the same issues until it becomes such an obvious issue. I mean, how long was it ago where Marlboro cigarettes or whoever, they smoked it? It was a positive thing, was the marketing ad. It was, to help you de-stress. And, it took years, but eventually they had to force themselves to say it could cause cancer, and, they were reluctant to, make the wording just right to where they weren't fully, completely liable, but there could have been a risk. And now everybody knows that you probably shouldn't smoke cigarettes. And my dad got lung cancer 30 years after smoking, kind of a thing, and everyone's surprised. This is what this organization is trying to prevent. For those of you listening, they're trying to prevent that story, or they're trying to correct it so that you have a higher utility, a better quality of life, that you recover in more of that model that Mary mentioned of a year or two versus never, or versus 10 years. And these are the people that have learned the hard way. And these are the people who have networked with folks with that experience to say, okay, let's try that. Let's see if this helps the patient. I've never seen a group of individuals work together so efficiently in my life. And I realize I'm not 150 years old yet, but I've been actively involved in a lot of different associations, and it's a great way for those to get started. You don't have to, love for you to join, be a part of IC to different capacities, but if you can make it, it's not just for clinicians, also IEPs, remediation companies, those who have serious interest in working with people who have chronic illness, that sort of thing. I don't know if it's been opened up or ever will be to the general public. I don't know, Mary, if I put you on the spot with that, or
no, we serve to exist as a professional society, which means we give certification and accreditation, that the public will need to make their own arm. And they do have some with mold, but I think they need one as broad reaching as ICI in environmental toxicity to continue the fight, perhaps more than we can. But so we do have, again, our mandate, our charter is nonprofit and professional. But professionals include an awful lot of people seeing the public. And so and many clinicians have joined because their patients said, you really need to, check out ICI and figure out what's going on if you want to learn how to treat me. And I love looking at this map because it started out, I'd guess, with Keith in Chicago and Sonia in North Carolina and me in Tucson. There were three.
Right.
And we now have people all around the world, which I'm proud of saying, but certainly many, many more people now throughout the US and in Canada. We have a cluster of people in Canada. There used to be one, I think they're now about 10.
Right.
And Australia, which recently fought and got their legislature to win their parliament to say that SIRS needs to be recognized and deserves research.
Right,
So
exactly.
Having something like that happen here, all of these are things that can happen as more and more people get educated and a lot more smart people do what's needed to address the complexities. That's the problem for IEPs. It is just not as simple as we're looking at particulate, or we're looking at a VOC, or we're looking at mold spores. It's just not that easy.
No.
And is to address the complexity makes the experiments much harder, but that's the reality. And until some of that's done, we still have an ICI stands as saying this is wrong and shouldn't happen. We have the whole legal system, usually insurers who don't want to give disability for these illnesses, and landlords who don't want to clean up the messes. And it is so much easier to just say, this is not a problem, you'll need to find another place. This didn't make you ill. Or basically, where I've signed a lot of people is, you're psychiatric. This is all in your head, of which we usually like to hold up the neuroquant and say, yeah, it is in my head, in my brain, quite real. It's like saying a stroke is all in your head. It's kind of saying the obvious, So that's the place where I see us going, where reasonable people avoid the dangers for themselves as best they can, learn to not buy homes as like, oh, this is such a bargain. The roof is leaking, the windows are leaking. Oh, I can fix that, and we can pump out the water in the basement, learn to leave it. You probably can't fix it. And, to stop those kind of mistakes from happening, or from oh yeah, we can eat, food that's just been desiccated by glyphosates because the government says it's safe. Okay.
Yeah.
Doctors used to say, hey, I smoke and I'm fine.
Right. There you have it.
Doctors, the governments can be very wrong. And what we're doing is to work with the people, the professionals who can get certified, have the public recognize who's telling them the truth as best they see it, versus those who are gaslighting them that it's not an issue, and that water leak is not a problem, we fixed it, don't worry. In Arizona, it all dries out.
Yeah,
what are we,
that's
six in the country in mold?
Thing with me, Mary. Still an everyday thing I get.
It with me too. I just sent you someone else who, their roof has been leaking, for 24 years, and they got someone to come and say that they thought the home was okay. And I said, you're really pretty sick here. And I just don't think you really got to talk to Mike. I don't think he's going to say this house is okay.
Yeah, we see that a lot. And for those of you listening, I know we were talking about, how IC can help transitioning into, some of you listening don't know where to start. And there's other podcasts on IEP Radio that talk about more specific topics. I'm getting ready to do a podcast in a couple of weeks on home inspection basics and things to consider when renting, which is right up Mary's topics that she brought up.
Things to not do, right?
Right. Just the big things that maybe not so obvious to the layman, but just know that ISEAI is a great resource as well. This map I'm a visual person, so this is wonderful for me as well. But you have a lot of people here as I scroll down who you can go see under the Get Help tab. There's so much, wow. There's so much power here and knowledge and big names across the board that you can reach out to people, and either they can help you directly or remotely. And that's one of the things I love about ICEAI is that they do that. Mary, I know you're a big part of this organization, and I tried to do a Google search. I typed in Dr. Mary Ackerley on Google, and like the first 8 pages is all about Mary. You have such a positive influence. I certainly didn't see anything bad in the screening I was looking at in this society. I know people can reach out to you, but I just want to give us a small plug, a way of saying thank you if I can. How do people reach out to you? I mean, can they go to your website? Or, I mean, last time I heard you're in high demand, so I don't know how your operation works.
I have now 2 staff members, one of whom also works for ICEAI too, and they actually, I'll tell a story I'm very proud of, is that they have listened to me for so long that recently somebody called, and I do a lot of consults. My interests really are more specialized in a sense in working with brain disorders. So I work a lot with psychosis, psychiatric issues, autism, people who develop depression out of the blue, dementias. And I should point out, I think now 30% of boomers are being said to have Alzheimer's by their mid-80s. And part of that is definitely fueled by the lead we had crawling around, the toxins, the food we've eaten, and mold and Lyme are very big parts of the Bredesen protocol in trying to restore brain thought. So anyway, going back to is you call, and Angela or Susie will pick up, and they're terrific. And somebody called, they had a 20-year-old daughter who has been diagnosed with Lyme and Bartonella and had been 4 years on quadruple antibiotics. This is on the East Coast. And she was functional enough that she could sort of go to college. She was still pretty bothered by severe depression. And every time they started to jiggle, this is 4 antibiotics for 4 years, which does a lot of damage to the gut and the brain. And every time they'd start to move her off one of them, she'd relapse, become more psychotic, have auditory hallucinations. One of my staff members actually said, well, Dr. Ackerley's going to want to know what your ERMI score is if she's talking to you. The woman in 4 years, that practitioner had never told them about mold. Right. So she went and got mycometrics, which say go to mycometrics and do the dust test, and at least you can tell Dr. Ack she's going to say, wait, are you sure about mold here? The woman did it. She read it. She talked to someone at Mycometrics who said, well, your home has more mold than 90% of the homes in the US. She then went on ICEAI and read some of this stuff that mold could turn the brain on fire and fuel even auditory hallucinations. She had already gotten in an IEP, said, well, that water in the basement has caused a lot of issues. And this was before I even saw it. That one was, I think, only about a four-week wait. Lots of times it may be 3 months beginning earlier, but I am really proud that my staff had done what this other medical practice using antibiotics for 4 years should have done. Said, right. Do you think you might have mold? So anyway, that's,
and that's the told that they went on ICEAI too, and they connected a few more dots to learn
right.
more.
And they got an IEP who said, right. Yeah, that basement, with that water is probably that source. And they had already looking for a place to get the girl out to a safe to get remediation. I think I had them call you, Mike, to just talk about it because I don't really trust everyone in the country. Mike is trying to develop a certification and a code of ethics for IEPs so that when you talk to them, they respect the health-related aspects. They don't do an air test and say, oh, there's nothing there. Ignore the other ways we have of testing, especially spore testing, not look for hidden leaks or look for places where it might be behind the walls and not getting into the air. who are supporting the fact you're searching for an illness that's severe, and respect that. So I think, Mike, we have to really, take our hats off that you're trying to get that level of professionalism and respect for health and cooperation. Respect and cooperation between people who have a lot to offer each other, working together in complexity. So my hats are off to what you're trying to do too. It's a big deal.
No, and I appreciate that, and it's easy to do, again, when you're working with like-minded individuals. One of the reasons why I'm so incredibly excited to be a part of this organization. Another reason I'm looking forward to this conference again coming up. You guys can learn more, for those of you who are listening but not able to watch. That's ISEAI.org, ISEAI.org. And if you're interested in learning a little bit more about Mary, just Google her. But her website is mypassionforhealth.com. It's my passion, the number 4, the word health.com. And you'll learn more about her. Mary, thank you for taking the time to not just highlight IC, not just highlight what it's there for, but being a big part. I know that my word may only be worth a few cents, but I work with clinicians across the world, and you at the end of the day, it's certainly you want somebody with the knowledge and the passion, but it's the ability to connect the dots. And I think that Mary represents that ability with a lot of the clinicians that are a part of IC, because inherently in the conversations they're having, you can see it on a day-to-day basis on listservs and things like that, just communicating. And it's such a powerful theme, albeit I'm sure it can be overwhelming. There's so much demand. It's like there's not enough Marys and Mikes and all other names that are out there. There's so many people out there that are more brilliant than myself who can be of help, but IC is a great organization. So thank you for taking the time, and maybe we can chat again in the future.
I'm sure we will be chatting again in the future, but I like that. That kind of sums it up. It's an organization we're trying to create, an organization of professionals who can connect the dots in chronic and complex illness between the symptoms, the illness, and the environment. In more than mold, it's what's causing this patient and what we have to do on multiple levels to get this person back to a state of health that they would be enjoying and deserve to enjoy if it weren't for some environmental toxicity that's been poisoning them unaware for years. So it is connecting the dots that's so important.
Absolutely. Thank you again, Mary. And again, check out IC's website, check out the conference coming up. And thank you again for your time. We'll talk soon.
Okay. Have a great weekend, Mike.
Of this show is for informational purposes and represents the sole opinion of the host and its interviewees only. Any reliance on the information provided in this show is done at your own risk. Additional opinions and/or research may change our current view of the topics spoken in this show. We do our best to minimize any inaccuracies presented and make legitimate efforts to back all comments with our own field experience, independent literature, or studies that support the topics discussed. This information should not be used to make conclusive decisions regarding your health or exposure. Ultimately, all questions and/or concerns regarding your health should be addressed by a qualified physician. Additional exposure concerns and/or questions pertaining to the health of your home or building should be addressed by qualified and on-site professionals. Any and all products and services discussed in this show should not be construed as a recommendation, endorsement, or a guarantee that their use is appropriate for your situation. In short, we hope this information is of value to you, but please do not act upon it without actual and individual consultation and guidance by professionals who have taken the time and appropriate collection of data to assess your unique situation.